Hereditary angioedema, or HAE, is a rare disease. It is estimated to affect between 1 in 10,000 and 1 in 50,000 people worldwide. About 75% of HAE cases are passed down through families. This leaves approximately 25% of people with HAE who have no family history at all. These cases result from a genetic change that happens spontaneously. Once the spontaneous change occurs, it can be passed on to children. A substance called bradykinin is considered to be responsible for the characteristic HAE symptoms of swelling and pain. Firazyr, or icatibant injection, is a prescription medicine used to treat acute attacks of HAE in adults 18 years and older. It is not known if Firazyr is safe or effective for children under 18 years of age. Firazyr is the only HAE treatment that directly blocks bradykinin from activating the receptor. Firazyr is also the first and only injection you give yourself just under the skin as soon as you recognize symptoms after being trained by a healthcare professional. Attacks of the throat, also called laryngeal attacks, can become life-threatening. If you have an HAE attack of the throat or laryngeal attack, inject Firazyr and then go to the nearest hospital emergency room right away. For additional safety information about Firazyr, please see the important safety information included in this video and the full prescribing information available on this website, www.firazyr.com. The most common signs and symptoms of HAE are repeated attacks of extreme swelling and pain. The number of attacks that people with HAE have can vary. Some people may have an attack every week, while others may have only 1 or 2 attacks per year. Attacks can occur in many different parts of the body, including the abdomen or trunk area, throat and skin, on the face, or extremities. Abdominal attacks of swelling can be painful and may cause other symptoms like nausea, vomiting, and diarrhea. An attack can start in the face or mouth and then spread to the throat. Attacks of the throat can be life-threatening. If you have an attack of the throat, you should seek immediate medical attention. The duration of an attack can vary. When untreated, HAE attacks usually worsen over 24 hours and gradually get better during the next few days, but some attacks, such as those that involve swelling of the extremities, can last for several days. Some HAE attacks can be triggered by stress, medical and dental procedures, hormonal changes, certain foods, and illness. Swelling may also result from other minor physical activities, such as prolonged sitting or prolonged standing. However, many attacks happen without any trigger at all. For this reason, it is very difficult to predict how severe an HAE attack will be, or when or where an attack will happen. People with HAE either do not have enough of a protein called C1 esterase inhibitor, C1-INH, or this protein does not work as it should. Because there is not enough C1-INH, or it is not working the right way, the body makes too much of another protein called bradykinin. Having too much bradykinin allows water and other fluids to leak out of the blood vessels and into areas of the body where they shouldn't. Bradykinin is thought to be responsible for the characteristic HAE symptoms of swelling and pain. Let's take a closer look at what happens inside the body during an HAE attack. Under normal circumstances, the cells that hold the blood vessels together are tightly linked. Think of it like interlocking the fingers of your hands. Blood and other fluids flowing through the blood vessels are unable to leak out into surrounding tissues. During an HAE attack, there is an increase in bradykinin inside the blood vessels. Picture bradykinin as a key that attaches to a lock. This lock is called a receptor. An increase in bradykinin means there is more bradykinin available to attach to the receptors in the blood vessels, or more keys that fit into the locks. The increase in bradykinin attaching to receptors causes the cells that hold the blood vessels together to loosen, similar to what happens when you start to pull apart your interlocked fingers. When the cells loosen, plasma leaks out of the blood vessels and into surrounding tissues. The leaking plasma causes the symptoms of swelling during an HAE attack. Firazyr is the only HAE treatment that blocks bradykinin from binding to its receptor. Firazyr has a structure that is similar to bradykinin. Imagine Firazyr as a key that is similar to bradykinin and can fit into the same lock. Due to this similarity, Firazyr can attach to the same receptor as bradykinin. During an HAE attack, Firazyr competes with bradykinin for attachment to the receptors in the blood vessel. When this happens, bradykinin can be blocked from attaching to the receptors. When Firazyr attaches to the receptor instead of bradykinin, the effect excess bradykinin has on the walls of the blood vessel is reduced, causing the cells to tighten and slowing the leakage of plasma into surrounding tissues. The most common side effects of Firazyr include redness, bruising, swelling, warmth, burning, itching, irritation, hives, numbness, pressure or pain at the injection site, fever, too much of an enzyme called transaminase in your blood, dizziness, nausea, headache, and rash. The safety and efficacy of Firazyr was studied in 223 adults with HAE. Firazyr was evaluated in 3 controlled clinical trials, and a range of patient responses was observed for abdominal and skin attacks. Across the 3 clinical trials, 2 hours to 2.3 hours after taking Firazyr, half of patients experienced a 50% reduction in the symptoms of acute abdominal and skin attacks. 60 patients who were treated with Firazyr for attacks of the throat had similar symptom relief compared with patients who were treated with Firazyr for abdominal and skin attacks. Attacks of the throat, also called laryngeal attacks, can become life-threatening. If you have an HAE attack of the throat or laryngeal attack, inject Firazyr and then go to the nearest hospital emergency room right away. These clinical trials showed that Firazyr can be used to treat acute HAE attacks that occur in different parts of the body, including the skin, abdomen or trunk area, and throat. In clinical trials, patients were monitored for immune responses to Firazyr. No hypersensitivity or anaphylactic reactions were reported. Firazyr is available by prescription only and supplied as a pre-filled, single-use, self-injectable syringe. It does not need to be refrigerated or mixed and does not require special handling. A healthcare provider will teach you or your caregiver how to inject Firazyr. Firazyr is given by slow injection over at least 30 seconds in a fold of skin about 2 to 4 inches below your belly button on either side, with each dose delivering 30 milligrams of Firazyr. If your symptoms continue or come back, you may repeat your Firazyr injection at least 6 hours apart, but do not use more than 3 doses in 24 hours. Tiredness, drowsiness, and dizziness have been reported following the use of Firazyr. If this occurs, do not drive a car, use machinery, or do anything that needs you to be alert. Firazyr is a treatment you can carry with you and give yourself as soon as you recognize the symptoms of an acute HAE attack after being trained by a healthcare professional. When considering Firazyr as an acute treatment for your HAE attacks, there are a few safety considerations to keep in mind. Important safety information. Laryngeal attacks can become life-threatening. If you have an HAE attack of the throat, laryngeal attack, inject Firazyr and then go to the nearest hospital emergency room right away. The most common side effects of Firazyr include redness, bruising, swelling, warmth, burning, itching, irritation, hives, numbness, pressure or pain at the injection site, fever, too much of an enzyme called transaminase in your blood, dizziness, nausea, headache, rash. In a self-administration study, 56 patients with HAE treated themselves with Firazyr as soon as they recognized the symptoms of an attack. The safety of Firazyr was about the same whether patients gave the injection themselves or had it done by a healthcare professional. Tell your healthcare provider if you have any other medical conditions, if you are breastfeeding or plan to breastfeed, or if you are pregnant or planning to become pregnant. Firazyr has not been evaluated in pregnant or nursing women. You and your healthcare provider will decide if Firazyr is right for you. If your symptoms continue or come back, you may repeat your Firazyr injection at least 6 hours apart. Do not use more than 3 doses of Firazyr in a 24-hour period. Tiredness, drowsiness, and dizziness have been reported following the use of Firazyr. If this occurs, do not drive a car, use machinery, or do anything that needs you to be alert. In clinical trials, patients were monitored for immune responses to Firazyr. No hypersensitivity or anaphylactic reactions were reported. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. For more information about Firazyr, ask your healthcare provider. For further information, please see the full prescribing information. You can also call Shire at 1-866-888-0660. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. More information about Firazyr is available online at www.firazyr.com.